Hey, Dr. Nate here, Thrive Dental Orthodontics, and today is going to be a little different because I'm going to explain basics of orthodontic assisting 101. I did this video, a few years ago, and I just want to clean it up and make it shorter and make it more concise for you guys so you can be the best, most well-informed orthodontic assistants ever. So let's first start off by kind of telling you what is an orthodontist. So all orthodontists are actually dentists, but not all dentists are orthodontists, right? So an orthodontist essentially went through undergrad, went through dental school, and then did some extra training, typically around 3 years to become an actual orthodontist. And all we're pretty much doing is braces, Invisalign, maybe some lingual braces. Our basic job is to straighten teeth. Now you may be thinking, what's the difference between an orthodontist and a board-certified orthodontist? Really, a board-certified orthodontist took some extra tests, may have done something extra on tabletop to make sure the cases and their examples are really good, but they really just took some extra tests to get that extra certification to be called a board-certified orthodontist. So not all orthodontists are board-certified, it's just a little extra certification on top of the degree that they already have. All right, let's jump right into what are braces. You might be hearing some different sizes, and when patients are coming from another office, they're talking about transfer cases and can I transfer? And the reason transferring cases or transferring one braces case from one office to the next office is difficult is because there's actually different sizes of brackets. So let me go through this, and I'm sure I'm gonna have some graphics up here that are gonna help explain this a little better. But braces essentially have two different sizes. So the slot size can either be an 18 slot size or 22 slot size. So what does that mean? That essentially just means the opening in the bracket, it depends on what size it is. So if it's 18 slot size, it's gonna be slightly smaller. If it's the 22, it's gonna be slightly bigger. And the real dimension is actually 0.018 inches or 0.022 inches. That's the actual dimensions of the bracket. So there's two different bracket sizes, okay? Within those bracket sizes, there's probably hundreds, maybe even thousands of different manufacturers that manufacture those braces. On top of that, there's actually different prescriptions within the bracket. So you have different bracket sizes, either it's an 18 or a 22, and then you have a different prescription, which is actually the tips and the torques of the actual braces themselves. So some of them have something called an MBT prescription, which is just one type of prescription that I tend to use. Some of them are raw. There's just a bunch of different prescriptions. And that's why it's so difficult when you have a patient coming from another office and they come to our office and they're like, hey, can you just finish our case? I only have 6, 12, 18 months, whatever left in the case. Can't you just kind of keep it going? And sometimes we can, but the reason sometimes we can't is because yes, two different sizes of brackets, multiple prescriptions, and then probably thousands of different manufacturers. So you have to think about all those combinations. So the odds of one person having the same bracket combination that we do is pretty rare. Okay, so now you know the different sizes of brackets, you know the different manufacturers and why it's so difficult to kind of use one case over here in one another office. But how do we actually number teeth? So if you're an ortho assistant, you're gonna know this, that the teeth numbering is quite a bit different than general dentists. So general dentists go 1 to 16, and down here they go 17 through 32, right? That's how typically they're gonna do it at almost every general dental office in the States. But orthodontics is quite a bit different. We go from the centrals out. So on the top, these two front teeth here, these are called ones. The ones right beside that are called twos. Canines are threes, premolars are 4, 5, 6, 7, 8 until you get to the wisdom teeth. So I would say, okay, let's bond the upper left one. That would be this upper left central tooth. You say the upper left two, that'd be one over here. You may also hear me saying, oh, let's bond all the braces, but we're gonna extract all fours. That would mean we're gonna bond all the teeth, we're gonna put braces on all the teeth, but we're gonna take out the first premolars later. So that's why it's so much different than general dental. So remember, everything starts from the middle. 1s, 2s, 3s, 4s, outwards, whereas general dentists go 1 through 16, 17 on the bottom, all the way through 32. So that is a big difference in tooth numbering in general dental versus orthodontics. Okay, so we've gone past the tooth numbering, you know what the brackets are. Now let's move our way into wires. I love this part because the wires are so unique, and this has everything to do with orthodontics. You know, the braces are important because they're glued onto the teeth, you know, that helps the teeth move. But really, the workhorse of braces is the wires. So really, there's two main types of wires. There's a flexible wire, and that's gonna be a nighttime. I'm gonna show that in a minute. And then there's a stainless steel wire. And stainless steel wire is quite a bit different than the nighttime wires. So we first start off with a nighttime wire, and let's talk about sizes, okay? So the smaller the number in general, the smaller the size of wire. Okay, so we start off typically with an either 12 nighttime or 14 nighttime. And in reality, the real number is 0.14 inches or 0.12 inches. So that's the actual diameter. So how do we know what that is? Like what's the diameter? What do you mean? So if you take a round wire, I know it's gonna be hard to see, but this is a round wire. If I were to cut it, if I were to take a cross section of this wire right now, this particular wire is a 14 nighttime. So if I took this cross section, the diameter of that wire is 0.14 inches, okay? But if I took this wire, like I know it's gonna be hard to see, but this is a thicker wire. This is actually a 16 by 22 nighttime. So if I did the same thing, I take a cross section of this wire, it's gonna look like a rectangle, and it's gonna be 0.016 by 0.022 inches. So it's gonna look like a rectangle if I were to do a cross section. Whereas remember this one, this is the 14, it might be a 16, 14 nighttime. If I take a cross section of that, it's gonna look like a circle. There's also what we have called as a 16 by 16 nighttime. And the 16 by 16 nighttime is, you guess it, you do a cross section of that, and it's gonna be 0.016 by 0.016, the diameter or the length of both those sides of the wire. Okay, so now you know the different sizes. I know it gets a little confusing, but let's talk again about the difference between nighttime, nickel titanium, and stainless steel. So if you look at this one, I'm gonna put that wire down for a second. This is the nickel titanium, okay? I can maneuver it, I can stretch it, I can do, put it into little circles, do all sorts of crazy stuff. And I take it away and boom, look, it looks exactly like how it was before. This is called nickel titanium. It always goes back to its same position. And so this is typically the wire you would use initially to start lining up those teeth, because if you use a stainless steel wire, it is way too strong and the patients are probably gonna hate you. So if we go back now to this stainless steel wire, remember this nickel titanium wire, I could wrap it up and it always goes back to the same shape. With the stainless steel wire, if I do a little bend in the wire, it stays in that same shape. So this is really good when you're trying to finish cases, when you're trying to make things look nice and pretty. If you need to do like one little step in the wire to make the tooth go up or down or left or right just a little bit, we finish off in the stainless steel wires. We also mainly use stainless steel wires when we're doing rubber bands or power chains. So let's move into power chains. So power chains are quite a bit different than just your normal elastomeric ties. Some people will call these colors. I don't know what other names they got for them, but this is the colors and this is the power chains. Some people call them power trains. I don't know why they do that. But the power chain is good because when you pull on these chains, it always wants to come back to the same position. So we do that when we're really trying to close spaces. So you have to imagine we put this on the patient's mouth or on the patient's braces, and as it's closing, it brings those spaces back together, and so it really closes it up. It closes up those spaces, right? So we'll use this typically on a stainless steel wire or a wire that's a little stronger. But initially, we'll start off with something like this. This is just your normal colors. This helps put the wire into the braces. And remember, like I said, the wire is the workhorse of the actual braces. So when we put these things on, you want to get the wire as close as you can to the actual braces. If the wire's not really in the bracket, if it's kind of like out, it just won't move the teeth quick enough or in the proper direction. So sometimes we'll do normal ties where we just put this normal, nice little color on the bracket. Sometimes we'll do, these little like cross elastics. We'll do a bunch of different ways to tie in this color into the actual brackets. Okay, hopefully you are following along. I know we've covered a lot of things. We covered the different brackets, the different prescriptions, the sizes, the wires. We covered the difference between power chains and regular ties. Now let's go over some basic terminology. This is gonna be super important if you're talking to your orthodontist or orthodontic friends, or you're talking to me. I wanna know exactly what you're talking about, and we gotta be very specific with our terminology. All right, the first thing is overjet versus overbite. If you know this difference, you're in like the 0.01% of the population that actually understands the difference. So let's talk about it. So overbite is the vertical dimension of how the teeth overlap in the front. So if the front teeth totally cover the bottom vertically, cover them like this, you know that they have a deep bite or a big overbite. That's vertical. Where overjet is different. Overjet is how much the teeth stick out, okay? So somebody could have a big overjet that feels like their teeth are sticking way the heck out, but they actually do not have a big overbite. Sometimes that happens, that's normal. So it sticks far out, but does not overlap. Or contrary to that, they can have a big overbite and have really no overjet. So those are the difference. Remember, overbite is vertical, overjet is horizontal. You can also have something called an open bite, and that is when people bite down, but their front teeth don't really touch. Typically it's in the front, sometimes it can be on the side, but that is called an open bite. You can also have something called a cross bite. So cross bite, sometimes we call that an underbite depending on where it's at, but a cross bite is essentially when the top teeth are on the inside of the bottom teeth. So if it's on the back, if those top teeth are too narrow, they're coming too far in, we call that a crossbite. If the top teeth are actually way too far out, like they don't even touch the bottom teeth, sometimes we'll call that a crossbite too. So I know it gets a little confusing, but either way, if the teeth aren't biting properly and the top teeth are too narrow or way too far out, we'll call that a crossbite. If the crossbite happens in the front, so it's in the front of the teeth, so normally your top teeth are overlapping your bottom teeth, but if it's the opposite, if the bottom teeth are too far forward, we'll call that an underbite or crossbite as well. And then you have your face position. So some people have a concave face shape. And what that means is when the top teeth or the top jaw looks a little bit behind the bottom jaw. So the facial profile looks concave. Then you can have something that's called convex, which is a kind of the opposite of that. And that's when the lower jaw is too far back. So it looks more convex. Or you can have straight, and that's when the teeth, if you're looking from the side, it just looks like a straight profile. So typically we have those three types of profiles. And then when we're talking braces or talking teeth or we're talking bites, we always want to know the difference between normal dentition or adult dentition and primary dentition. And when we're naming them, I know we went through this in the start, naming goes from the middle, right? 1, 2, 3, 4, 4, all the way out to 8. And it's actually the same thing with baby teeth, but you don't start with numbers, you start with letters. So the two front teeth would be the letter A, B, C, D, E as you go to the back. So it's the same concept as adult teeth, but it's with letters, not numbers. And then when I'm going through the consult sheet, sometimes I'll talk about frenums, and frenums are just a piece of tissue that attach pretty much from the gums to the lips. So sometimes if the frenum is really big, you'll see this if people have a big gap in between their two front teeth, you pull up their lip, they'll have this big frenum, and that's just a piece of tissue that's kind of sticking in between the teeth. And last thing on this consult form I will talk to you about is treatment time. At our office, we try to keep things very consistent. So typically our treatment times are anywhere from 6 to 12 months, 12 to 18 months, 18 months to 24, or 24 to 30 months. If it's gonna go 30 months and beyond, we're just gonna call it 24 to 30 months. But we like to keep our treatment time uniform. And most people, I'd say maybe 70% of our patients are in that normal treatment range, which is 18 to 24 months. What about dental classifications? I almost forgot about that one, and this is super important. You have a class 1 individual, and that's when the canine, the top canine, goes in between the bottom canine and the first premolar. So class 1 is typically the best type of bite. That is a bite we're all searching for. and that is just it looks the most aesthetically pleasing, and that is in general what the end result will be when people get done their braces or Invisalign. Class 2 is typically what you'd think of somebody who has a weak lower jaw. So that's when the lower jaw is pushed back compared to the top. And that patient most likely is going to have a big overjet. They may have a big overbite as well. But class 2 individuals is the second most common type of bite to have. And then you have class 3, and class 3 is those underbites. And that's when the lower jaw is too far forward compared to the top jaw. We don't see those quite as much here, and they're really hard to treat. But that is the 3 type of jaw and teeth classifications. So in your basic orthodontic set, you have a mirror, an explorer, a bracket placer. These can look a little different. This is for the front teeth. You have a cutter, a wire cutter, so you only want to cut very, very small wires with these. You have a math owl. Math owl is used for the power chains or for the clear colors or the color colors. You have a distal end cutter. This is what you use to cut all the ends of the wires. And then you have a wine guard. Well, sometimes we'll use these to put the wires in if the wires are difficult to put in, or if we're using them for open coil springs. But these are the instruments that you would have for your typical orthodontic adjustment. And when you're taking off the braces and when we're smoothing out the teeth, you typically have 3 types of burrs that we use. This one right here is called a donut burr, and that just helps take off the edges of the teeth to make the teeth nice and smooth at the end. Then you have this orthodontic debond burr, and that takes off the majority of the composite that is left off after the braces are taken off. And then to smooth out everything at the end, use that white stone, and that just makes the teeth look very nice. Okay guys, Dr. Nate here, Thrive Dental Orthodontics. I'm so happy you made it through this video. You know a lot about orthodontic assisting. You know the teeth numbers, you know how to name them, you know the classifications, you know what the difference is between an elastomeric tie and a power chain. You know the different types of braces, you know the instruments, you know how to clean them. You're like a full-fledged orthodontic assistant already. So thank you for watching this video. And as you know, I'm making videos every single week. So please like and subscribe, and I'll see you guys next week.